Hello, I'm Orvin Fillman, Vice President for Behavioral Medicine Services for St. Helena Hospital Recovery Center here in Napa Valley. So, you've decided to get addictions treatment. Great, good for you. And you've decided to use your insurance to pay for it. Make certain to listen to the next few minutes because I'm going to give you an orientation to the continuum of care for addictions treatment and how to interact with your insurance company. So the purpose of this orientation is to review three things: the ethics and best practices as it relates to substance use treatment, the levels of care for the continuum of care in substance use treatment, and how we and other providers of our kind would interact with insurance companies. First of all, we start about the ethics. For us, ethics and best practices are founded in our policy, and here it is. We provide clinical services, not vacation services, not seminar services, not travel services, but clinical services at the appropriate level of care, and thirdly, as determined by the recovery center itself here at St. Helena Hospital. Our levels of care that we provide must be driven, like I said, by best practices. How do you decide that? Well, there are two major references. We use nationally recognized admission criteria. Two include the InterQual level of care criteria and also criteria as established by the American Society of Addictions Medicine. So let's go through those levels of care. The highest level of care is medical detox, or medical detoxification as it's sometimes called. The clinical presentation for people here are those who are in imminent danger of withdrawal, a problematic withdrawal from their substance of use. And we have major medical problems that can even include coma and death if not treated appropriately. So where is this service provided? It is provided in a hospital. You would come to St. Helena Hospital, we provide it on the Med-Surg unit, or we also at times provide it on our locked psychiatric unit. Sometimes people are suicidal during their withdrawal period. As such, it's a compassionate intervention to make certain that their detox takes place on a psychiatric unit where they not hurt themselves. But most of the time, it's on a Med-Surg unit. Next, the next lower level of care is the rehab level, or sometimes called the residential rehab level of care. The clinical presentation here is that people are at moderate risk for severe withdrawal. It does require 24 hours of structured programming, and medical monitoring may be indicated. This is provided at a residential level. Here in California, it's licensed as a house. I sometimes joke that it's called a cabin in the woods because that's how it's licensed. We're fortunate here at St. Helena Hospital to have our unit right next to the hospital, adjoining the hospital. So as people come in and have other problems, we are very close to things like an emergency room or even a cardiac unit. It wasn't long ago that someone actually had a heart attack during their treatment. So if you have to have a heart attack, it's nice to have a heart attack right next to the cardiac unit. We also have another licensed residential treatment facility adjoining our facility. It's about 2 blocks away. We call that Woodland House. The next lower level of care, and this is the one that people are sometimes shocked to hear, something called partial hospitalization. We call it PHP for short, or partial hospitalization. This is a 6-hour program, and insurance covers 6 hours of intervention per day, and they include 1 meal during the day, and that's usually the noon meal. These people are at moderate risk for withdrawal. They have medical problems that can be dealt with during the day, and they may need some psychiatric stabilization, but they typically go home at night. And people come to me and say, Orvin, I just came to you from Montana. What am I going to do for the rest of my day? So we know that this is common since we are a destination medicine facility. And so we have helped people do that by making some courtesy board and room housing available. Insurance does not cover this, by the way. So it is a courtesy. We have 3 different options for you. I mentioned the recovery center unit attached to the hospital. We have a residential house in the area. And by the way, we also have an old nursing dorm that's on campus when this used to be a teaching university for nursing students. So that's there. Some Spartan surroundings, but it's economical for those of you who would choose to have treatment here at the Recovery Center. Also, it's perfectly fine at this level of care if you choose to stay in one of our fine hotels in Napa Valley, that's fine. Or maybe you have some friends in the valley, that's just fine to stay there during the evening and then come during the regular 6 hours of the presentation of the program itself. The next lower level of care is intensive outpatient. Here, once again, the risk of severe withdrawal is much less. But the person here at this level of care needs regular structured services, and that's usually about 3 to 5 times a week for about 3 hours at a time. The next lower level of care is typically the outpatient-based services. That's where you would go to see your psychologist or maybe your psychiatrist. Likewise, maybe a marriage, family, child therapist or a licensed clinical social worker, which is something would typically have happen after the major rehab portion of your treatment. And we encourage this especially for things like family therapy. Now let me talk just a little bit about insurance interactions. It may be of interest to you to know how we will interact with your insurance company at your request. There are 4 steps. The first step is this. We do an eligibility check. When you request us to, we will contact your insurance company and we'll determine what is covered in your benefit plan. We might even then give you an estimate of common out-of-pocket expenses for someone with insurance like yours. Does this mean you have authorization for payment from your insurance company? No, not yet. Step number 2, we will then do a screening. That is where we will ask you some very personal questions about your medical history and about your drug use. From that, we will make an educated guess about the type of treatment that you do need. Have you been authorized for insurance payment at this point? No, not yet. Third, we will meet you person to person and we will do an assessment. We'll take some lab tests. We will call in the results to your insurance company and ask for authorization for payment. At that point in time, we will have our first authorization from an insurance company as to what they will or will not pay for. The 4th step is concurrent reviews. We will call in to your insurance company at regular intervals and report to them how you are doing. We will let you know if there is a change in authorization and changes of level of care. Now, there are times when the insurance company will say, we are only going to provide this level of care. You're the ones with a license, you're the clinicians, but we don't think anything other than this is what's needed, so we're not going to pay for any more than what's this personal level of this individual level of care. Well, at that point in time, we realize that your insurance company does not have a license to practice medicine. They are not the ones responsible for you. We are. And so we then say, what should we do? The first thing we do is say, well, do we agree with the insurance company? And if we do, treatment just continues just as usual with your individualized treatment plan. But if we do not agree, then we have another decision to make. We've talked about the different levels of care. What is common is for the insurance company to say, we will not provide the rehab level of care, that 24-hour care, but we will provide the 6-hour level of care. Well, we then go to those clinical criteria and we say, okay, does this person meet the clinical criteria for partial hospitalization? If we don't believe so, then we have to decide whether we would keep the patient or not. If we keep the patient, we will then adapt the treatment plan to match the clinical symptoms. So let's give an example which is real common. Like I said, one of the largest insurance companies in this nation does not cover the rehab level of care, but they cover partial hospitalization, that lower level of care. When we accept a patient in those conditions, we keep them on the unit. Even though they're a 6-hour day, we ask them to have a modified treatment plan that has them agree to the fact that even though their insurance company is only paying for 6 hours a day, we're asking them to do something more rigorous. So that is common. We once again will be true to the patient. We will set the treatment plan according to the clinical presentations, not according to what somebody else outside tells us needs to be done. And if we can't provide the treatment for you, we will tell you and we'll help you with the discharge process that may be needed. We'll help you find a place that more matches your clinical presentation. We are committed to providing you a level of care that is appropriate for you. We don't think you should have to pay for a higher level of care if you need a lower level of care. We think that it's unethical to sell you a higher level of care if you only need a lower level of care. And finally, we tell you this, that we will professionally advocate for you appropriately with your insurance company, and we will keep you informed of that continuum of care change as you move through that continuum of care. Again, congratulations for choosing to start that road of recovery. I wish you the very best. Thank you.